Okay, good morning, everybody, and thank you for joining us for a joint IPNO and UHR Town Hall. Today, you will be hearing from two of the university's senior leaders, Vivian Fernández, Senior Vice President, University Human Resources, and Tony Calcado, Executive Vice President and Chief Operating Officer. This presentation will be recorded. During the presentation, you may submit questions by using the question answer feature at the bottom of your screen. With that, let's begin. First, I'd like to introduce Vivian Fernández, Senior Vice President, Human Resources. Unmute yourself, Vivian, sorry.
See, we actually went through a dry run. Evidently, it didn't work. So thank you, everyone. We'd like to welcome you. We're so happy to be able to do a town hall specifically dedicated to IPNO and University Human Resources. As you know, over the course of the past 18 months, these units have worked vigorously in order to support the academic enterprise and the healthcare enterprise of this university. Our groups are often the unsung heroes, but without you all and your contributions and your dedication, the university would not be where we are now. We understand over the course of the past 18 months, some of you worked remotely, had to abruptly go to remote work, and were able to very quickly adapt and do what was necessary in order to support the university and continue operations. Others had to remain on campus, which was very difficult, especially given that we were at the epicenter of the epidemic. Everyone worried about their families, managing childcare, managing safety issues, but still dedicated to the university and contributing in ways that has allowed Rutgers to be at the forefront of campus safety across the nation. So much so that we were the first university to mandate student vaccination. And currently, Tony, what is our community vaccination rate?
So our community vaccination rate is over 95%, and that's out of better than 90,000 individuals.
So that's quite a testament to how safe our campus is and how other universities have looked to our practices in order to address their own processes and procedures around COVID-19. So we thank you for your contributions. We're very happy to dedicate time to you, given all the time you dedicated to supporting the university community. So we're happy to be here today and take your questions. I know a lot of you are concerned about the future, about what the fall holds, given the Delta variant and schools opening and what that means. Please be assured that the university is looking at those issues in a comprehensive manner, and we'll be balancing work life, employee well-being, and maintaining the mission and the vision of this university. As an example, the president has appointed a future of work task force, specifically tasked with looking at issues related to the future of work. Work has fundamentally changed as a result of COVID-19, and we have to change with that. So we have to look at ways in which to be more flexible in the workplace without losing sight of the mission and vision. Again, if it's not for our students and our patients, we don't have jobs. So that's very important. Our students are very anxious to initiate a real campus experience. We can't do that if the campus has no employees. So I know there are a lot of questions related to telecommuting and flexibility. Just know that we're focused on maintaining a balance between flexible work schedules and supporting our university. And for those of you who have to remain on campus because of the nature of your work, where there is not flexibility to work remotely, please know that we are working through ways in which to recognize your contributions and provide flexibility to you too, because we value all employees equally. Again, you are the backbone of the university, often the unsung heroes. Without you, we would not have been able to serve as a national model in higher education in the way in which we manage COVID-19. So we thank you. We're looking forward to your questions and spending some time with you.
Thank you, Vivian. And now I'd like to turn it over to Tony Calcado, Executive Vice President and Chief Operating Officer.
Thanks, Liz, and thank you, Vivian. So let me add a couple of points to what Vivian talked about. So this has been a long haul, and it's affected us not just physically. Many of you know people who may have contracted the virus and were sick or very, very sick. And some of you know people who actually passed away because of the virus. So, you know, there is that toll, the physical toll that it's taken on us. There's also the mental toll that it's taken on us. And 18 months, we always use that number now that we're in August, of 18 months of really confronting this virus and being on unsure ground for so long and not knowing what the next steps will be and what we will look like as we move forward takes its toll. And it takes its toll in a very different way. And it can be manifested physically, but everyone needs to pause and try and clear their minds and understand that we will get through this as a community. We need to lean upon our loved ones, and we need to lean on our friends in order to continue to move forward. We do not know what the future will bring. And part of what makes us anxious is that not knowing, right? The instability of what the next variant or mutation or any of those may look like. I'm going to ask Vivian at the end to speak a little bit to some of the resources that we have with respect to mental health, because I think that it has become as important, if not important, even than vaccination at this point in time. So we talk about 18 months, but the reality is we're at this about 20 months. We started in January of last year of 2020, as soon as we came back with study abroad and global. And starting to look at those students, understanding that there was something happening in China that we were unsure of, and it was happening in Wuhan. And we had students in Wuhan. And not only did we have students in Wuhan, we had students here from Wuhan who then were very anxious and concerned about their loved ones and their families that they had left behind. Note that, interestingly, those students were unable to return even when the semester ended, and we sheltered them for an extraordinary amount of time, understanding that they had no home to go back to while China was on lockdown. And just think about how they felt as we go through our normal course of business on a daily basis. So I thank you, those of you who supported those students throughout not just the fall semester of last year, I'm sorry, not just the spring semester, but through the summer as well. You all did yeoman's work in making sure that they were taken care of while taking care of yourselves. So Vivian noted that we've taken a very go slow approach, and we have. We're very different than every college and university in the state of New Jersey. You could put all of them together and we will still be bigger than all of them together. So we have a much different scope as we move forward. And we noted that, and we knew that. And we knew that there were different rates of illness and disease in different parts of the state, although we were all smack in the middle of an epicenter of this disease. So what changed from last year to this year? Vaccine. That's what changed. Vaccine enabled us to begin to find a path forward, a light that we could move towards as we look to repopulate and stand up our university. We lost a portion of our spring 20 semester. We lost all of our summer. We lost all of our fall 20 semester. We lost all of our spring 21. We lost our summer 21. That's 5 semesters that we lost. This is the 3rd year with academic disruption associated with it, because there's still academic disruption even as we move into 21. When you think about the fact that so many of our classes will still even be online, irrespective of what we're trying to do here. So let me talk a little bit about what some of our mitigation strategies are in trying to create a safe campus. Of course, mandating vaccine for students was our number one. And Vivian talked about how we were the first in the nation to do that. I just heard this week that there are now over 850 schools and colleges and universities in America that have done that. The last big explosion was actually when Pfizer was authorized as came out of EUA, emergency use authorization, and received permanent authorization. Many colleges and universities in certain states like Ohio could not mandate under EUA specific to what the governor of Ohio had put in place. So they now did. We have, as of this morning, we have a total of 64,399 students. And we are looking at 804 that may still be a problem that we are working with we are trying to work with to bring everybody on board. So we are in very good shape. That's about a 1.2% non-compliance rate. We're not concerned about that. Those 804 may not even be coming here. So we will figure it out. When it comes to higher ed, you never know until the day you start who exactly is stepping into your classroom. So we're working through that and we'll get there. We did mandate vaccine for certain staff, covered individuals, right? 860 or 70, Vivian, if I'm not mistaken, that had to be vaccinated as well. These were forward-facing, patient-facing staff, some of them in IP&O. So our public safety folks were mandated to be vaccinated. So we do have a mandate for certain staff. We get asked all the time, why did you mandate student and not staff? Well, we did. In the balance of our staff we're working with, we try and work with on a regular basis about educating when it comes to what does, vaccine mean and how does it protect you, and what the side effects are, the efficacy, the safety, and try and get that out as much as we can in talking to the rest of our staff. You saw the numbers, that has paid off. We are at about an 85% rate just for faculty and staff alone. So we are very happy with those numbers without having to mandate for the rest at this point in time, at least. Masking indoors, we've never changed that. That's remained where it is. Distancing in our office environment, 6 foot apart, remains where it is. Testing of those that are not vaccinated. The governor mandated that last week. The governor mandated vaccine or testing. We were already doing that. And those of you who have not uploaded your cards, we assume are not vaccinated, receive personal emails telling you how to get into the queue in order to be tested. And you're automatically enrolled, but you need to sign up at the same time. We will be following up and continue to follow up. So expect to hear from us as we move forward. So in these mitigation strategies, we're looking to balance really our safety with comfort. We understand that sitting in a cubicle for 8 hours a day with a mask on is tough. That's why the rules allow you to remove that mask if you are 6 foot socially distant, sitting in a cubicle by yourself doing your work. When you get up, you need to put it back on. But we are trying to balance that. People say, what more are you doing because of the Delta variant? It's not what more we're doing, it's what we did not stop. We were ready to stop mask mandates. We were ready to stop testing. We were ready to stop social distancing in office environments, and we chose not to do any of that. We chose to remain with those because of the Delta variant. I also will tell you that the science, and that's where we've been since day one, the science tells us that those of you that are vaccinated have a 97 to 99% chance of not coming down with any, there may be breakthrough cases, but not coming down with serious illness or, God forbid, hospitalization or death. So we are confident in what vaccines can do. We continue to offer them. When boosters are ready, we'll continue to do that as well. In the end, it's a shared responsibility amongst all of us. And I want to share a little bit of the three questions I get all the time. So one is HVAC. What have we done with HVAC? So our people, it's our people, have been out there since March of 2020. I think they've accomplished something like 30,000 PM work orders with HVAC. They have changed every filter. They've optimized the working of the systems. They've looked at every single one of them. They have really done yeoman's work. Those are our people, our colleagues in IP&O that have been doing that since day one while they've been here. There is a pretty good, I think it's an excellent question and answer section on our website that shows how we align with CDC recommendations with respect to HVAC. I would recommend everyone to take a look at it. You can see what the recommendations are, and you can see what it is we've done about those recommendations. The second question I get all the time, but I'm not going to answer this, I realize there's someone here better than me, is about accommodations. Vivian, can you fill in about accommodations?
Yeah, so individuals are confusing accommodations in terms of, can you make a special exception so that I can telecommute versus the types of accommodations to which employees are entitled because of the law. So there are medical accommodations. So if individuals are requesting a telecommuting arrangement or another type of flexible work arrangement or some type of leave related to a health condition, they can go through the Office of Employment Equity and request an accommodation. There are also religious accommodations for things like the vaccine, medical accommodations for the vaccine as well. But the workplace accommodations are handled through the Office of Employment Equity. Those are the only accommodations. Anything else, if you are requesting special work arrangements that have nothing to do with a medical condition for yourself or some type of religious accommodation, that those are not the types of things that fall under the category of an accommodation. And it's really an interactive process with your supervisor and in the area to see if they can accommodate your request. I will talk a little bit about telecommuting in a couple of minutes to clarify some of the confusion that exists around telecommuting and some of the expectations around telecommuting, and then talk about our plans moving forward in order to really establish policies, procedures, and an infrastructure to better support this function as we move forward.
Thank you. So the third question I get quite frequently is, why now? You know, I'm doing my job at home and I can, why do I have to come back? So Vivian touched on this a little bit because we're built for in-person support of our students and our patients and our research. That's the way the university is built. We don't have an infrastructure to be able at this point in time, and I think that Vivian will touch a little bit more on this a little later on, an infrastructure in place in order for us to be working from home successfully across the board. So let me be clear about that. The pandemic forced us into turning around, getting out there, working from home, flatten the curve. And we did it sometimes without even laptops. And we wound up having to run around everywhere to get enough equipment to give to our employees so they could do it from home. That's not the way you execute something on a permanent basis. It is just not the way to do it. So I hear two things when it comes to working from home. I hear all the time, I've never been so productive as I am now. And so why is it that I need to come back? Well, your productivity, as you see it, may not be a true measure of productivity. If you're getting to your emails at 8 and 9 and 10 o'clock at night, and the person that sent them to you was working in the morning, that person's productivity is now impacted. So that person doesn't get to do their job until the subsequent day. So it's not catch as catch can. And it's not the productivity of an individual, it's the productivity of a department or of a university as a whole that we need to look out for. And we need to have the right tools in place to do that. And then the second thing I hear all the time is, I've never worked so many hours in my life as I do now. We don't want you to do that. We have no interest in you working at 7 or 8 or 9 o'clock at night. I started this talking about mental health and mental health resources. That's not a good thing. We don't want you working at 7 a.m. and working at 7 p.m. and being on your computer and doing those things. That doesn't help. That doesn't help you. It doesn't help your family. It doesn't help the university in the long haul. So we do not want you doing that. And I think I will stop there. We make lots of decisions on a regular basis. We look at every single one of these decisions. We revisit them. Sometimes we revisit them ad nauseum. Sometimes what we start with in the morning, we end up someplace completely different at lunch, and then we're back to where we started in the morning by the end of the day. So we beg your patience with us. This is new to everyone. No one's ever really shepherded a university through a pandemic in any one of our lifetimes. So we are trying to take into account every detail as we move forward, including your well-being as well. So I'll stop there and turn it back to Liz or to Vivian if you want to backfill anything there I may have touched on.
Okay, we can start with.
Why don't we go right? Why don't we start? Why don't we go through the questions?
Okay. So thank you, Tony. And we do have some questions that I received prior to the meeting, but I also encourage anybody who's listening now, who's attending this meeting, if you have questions, you may use the Q&A function at the bottom of the screen to submit your questions, and you may do so anonymously. We don't have to know who you are, and we certainly wouldn't be announcing the names. So the first question is for Vivian. For those of us who have demonstrated that we can successfully work from home, is there a possibility that after this year, we would be able to continue to do so 1 to 2 days per week?
Yes, thank you, Liz. So we hear say, and we understand that the pandemic has served as an accelerant for the greatest transformation in the way in which we do work in our generation and in our lifetime. But this happened again, it served as an accelerant. So it happened abruptly and quickly. As I referenced earlier, we have a Future of Work committee that will be looking at building out the infrastructure and the protocols and the measures of productivity in order to be able to facilitate a more flexible workplace. That brings in a lot of different things, as Tony indicated. Measures of productivity need to be universally understood and agreed upon. Hours of operation need to be universally understood and agreed upon. The protocols in place, things as simple as protocols in place for meetings, et cetera, we need to have an infrastructure for that as well. So what we did, I often say, during the pandemic, during the height of the pandemic, we did anything and everything to stay in business and protect our academic and healthcare enterprises, which means we made a lot of allowances, people being able to call in while they were, in the supermarket trying to stand online to get some milk, individuals with their pets and their kids coming in and out of meetings, set up in every corner, the garage in their homes, anything they could do, because we were all in this together. And our focus was, again, maintaining the academic and healthcare enterprises and keeping our university community safe. As we move forward, if telecommuting becomes, and flexible work schedules, so I just don't want to say telecommuting, I want a category that is flexible work schedules, telecommuting of which might be one option under that. If that is to be the new normal, because we have to look at work very differently than we did before, then we need an infrastructure in place, we need policies, we need procedures, we need expectations that are clearly understood and communicated, and measures of productivity. So yes, we will absolutely be looking at flexible work arrangements, understanding that the world has changed, forever changed. So we will be looking at that, but There will be protocols and procedures and policies in place in order to protect everyone.
Thank you, Vivian. The next question, Tony, I'm going to throw to you. It was stated in a previous meeting that you are allowed to come into the office with COVID as long as you have the vaccine and are not showing symptoms. When this was questioned, we were told it would be looked into, and we have not heard back since. According to the CDC, this should not be done. I would like clarification on why this was decided, or if this statement has since been retracted, for that to be stated in our meeting so that people know when they can or cannot come into the office. Unmute yourself, there you go.
So that is completely erroneous. I don't know how that may or may not have gotten around. If you have COVID, vaccinated, unvaccinated, partially vaccinated, stay away. Stay away. Stay home, quarantine, do all the things that public health tells you. I think where there may be a confusion is that individuals who are fully vaccinated and are exposed to a positive case, but do not have or not infected, may go about their business. There's no doubt. If you look on the returning to Rutgers under quarantining on page 6, the guide that just went out this past week, you'll see that there. So it's under quarantining. I will actually even read it for you, right? So fully vaccinated individuals who are exposed to a positive case of COVID-19 but remain asymptomatic are not required to quarantine and may continue their regular duties. That comes out of the CDC playbook. We didn't make that up. That came right out of CDC. So please, if you are symptomatic or you test positive, please stay away, stay home.
Thank you. The next one is for you as well, Tony. Will the vaccine be mandated at the university for employees who have not already been identified?
So it's hard to speak to the future. We are very pleased at the university, and actually we've very much tried to not go down the route of mandating vaccine. We hope not to have to do that. If our numbers continue to improve in the way that they have, then most likely that will not be the case. So we're hoping not to go down that path. As I stated before, we are at better than 85% with respect to faculty and staff in either fully vaccinated, partially vaccinated, or have some type of a waiver. So we're hoping that that does not become the case at all, but there's never any promises, right, as we move forward.
Okay, thank you. And Vivian, this question is for you. How long will the hybrid schedule, in-person and telecommuting, be in place, and will management continue to be flexible with staff who have childcare challenges based on their individual school districts?
Sure. So currently, the relaxation of policy to allow for telecommuting is in place through the end of the year. I've already spoken a little bit today about the future of work task force that will be looking at creating an appropriate infrastructure to allow more flexible work schedules. We have been asked the question related to childcare and flexible work schedules, and we have from the onset indicated to supervisors that we support the maximum flexibility during the pandemic in order to support our employees and be able to advance the mission of the university. However, we've also gotten questions related to childcare in terms of childcare is too expensive. Can I just telecommute? Or I have my kids at home, can I telecommute? So it's important to note that when we establish an infrastructure for telecommuting, and even now, as we have moved from crisis mode in the pandemic to a more steady state, telecommuting will not be approved for the purpose of caring for your children. If you have a telecommuting schedule, you must have childcare. Now, we will be flexible as we go back to all schools are open, so remote learning is not an option for public schools in the state of New Jersey. However, we understand that with the Delta variant and Lambda variant and whatever happens that the fall is uncertain. So if there are instances where schools have to send classrooms home because for 10 days during some type of incubation period for quarantine because of an outbreak, we fully expect supervisors to be flexible. However, we will not approve remote work schedules in order for individuals to care for their children, because during working hours, you have to be working. And when I indicated earlier that the things that we managed during the pandemic, because we're all in this together, we're trying to keep our community safe and the university operating, was one thing. We are now in steady state. And as we look at our infrastructure and protocols, working hours are working hours, whether you're working remotely or you are physically at work. So again, we will be flexible, especially, with schools, if kids are sent home for quarantines or we go back to some type of remote school and learning. We'll be flexible in that respect, but we will not move forward with any policies or procedures that are about childcare in telecommuting, or approval of flexible work schedules that, as Tony indicated, we have to balance supporting our employees and creating work-life balance and really allowing flexibility so that our employees are better engaged without impacting other employees. So as Tony said, if you have a flexible work schedule where you could respond to emails at 8 and 9 o'clock at night, while that was acceptable at the height of the pandemic, we're going to have regular work schedules and protocols in place in order to continue to operate efficiently and not negatively impact our students, our patients, or our colleagues.
Thank you. Tony, this next question is clearly for you. Has any significant funding been set aside for deferred maintenance projects? Our aging buildings and infrastructure are showing their age. I hear constant complaining from the researchers, building occupants. The constant breakdowns are taking a toll on our employees, especially the people in utilities operations.
So there are, in the budgeting process, there are always some funds set aside for deferred maintenance. We continue to work with the chancellors as to what their priorities are versus what we know the priorities are, because sometimes we want to make sure that these things align, and we'll continue to do so. There's also another source now that we're working around, which is the American Rescue Plan, which was the COVID funds many of you heard about. And we're trying to make a case that for HVAC upgrades, for instance, that those funds should and can be tapped. So we are working with the state to determine just how we can do that. And hopefully we'll have some good news in the very near future.
Great, thank you. So now we're going to turn to some of the questions that have come in from our attendees this morning. A couple of these we may have already answered, so I'm going to skip ahead to this one. We are following a schedule now for every other day on campus. Every other work groups are on campus 1 week and working remotely the next week. These are not true cohorts for safety, and the schedule seems arbitrary. More so, there's no alignment with my job requirements to be on campus for job site meetings. Greater flexibility to be on or off campus would make more sense.
Vivian?
Yeah, so I think, Tony, we're going to have to double up on this, because some of the things related to safety on campus and those things are Tony's, and then the work schedules are mine. So we indicated to all department heads and leaders that they were to establish these hybrid work schedules based upon the business needs of the unit, and under the premise, based on the communication from Dr. Holloway, that we are open and operational for the fall semester. As I've indicated before, our kids' parents aren't paying room and board and tuition to have our students in a ghost town. So we do have to have offices open and operational for the needs of our students and our patients. And those schedules different departments may have different schedules because they've arranged the work differently or because of their business needs. Their business needs may be very different. So you can't look at your unit and say, we're doing this and this other unit is doing that, and that doesn't make any sense. In terms of safety, everybody is expected to maintain the safety protocols as stipulated in the Return to Rutgers guidelines. Tony, do you want to speak to that?
Yeah, look, the third leg to that stool that Vivian talked about is the social distancing to the degree possible. We're looking at that 6-foot social distance. You know, there's sometimes individuals believe that they hear about this, you know, 1 week in, 1 week out, and 50%. Well, it's not based on a percentage, right? It could be everybody in all the time. We've not really made a big case for that. We've kind of allowed people to come back a little bit, probably a little more open than we should. There are a lot of areas that could be 100% now, but we'll work towards getting to 100% sometime in the early fall. I should put that warning out there now, because I know that there will be a lot of people that will be disappointed, and we want to be transparent with you. This is not a permanent schedule.
But Tony, again, 100% means 100% of employees are required to come to campus, whatever that schedule looks like. So it could be this group comes in 2 days a week, this group comes in 2 days a week, this group comes in 2 days a week, so we're not sacrificing safety protocols for the purpose of having individuals on campus. And when we say 100%, it isn't everyone coming at once. Safety is a priority for us.
Thank you. The next question, when will we stop having to submit exemption request forms for hiring for critical vacancies that have already been delayed due to the pandemic?
That's yours, Tony.
IPNOs, critical forms alone. So that is, I will tell you all that I believe that is, so that finance wants to make sure that that these are all documented in a way that is easy to be able to read. I apologize if there's ever any delay in getting them. I know that I try and turn them over as quickly as I get them, typically now on the same day. So I'm not sure if that would create a delay somewhere in the pipeline. I know that UHR does not require them to be reviewed by them, right? Vivian's team does not review them. They just want to make sure that they're there because they've already been attested to by somebody like me. So I know it doesn't stop anything at UHR. So if there is a problem in the pipeline, someone needs to kind of get back to me offline, and I certainly will look into that.
Okay, thank you. Next question, of the vaccination numbers talked about, how many in those percentages have received accommodations, medical or religious?
So for students, it's under 2%. For faculty and staff, that number is a little more squishy, because that number in the waiver number are 10-month employees, and 10-month employees don't come back until, well, tomorrow. So there's time for them, and we've seen that number going down and down as they're starting to come back. That number looked more like 5% as I saw it this morning, but again, that number is going to change and be lowered. Waivers are not automatic. They're not that, I don't review them, but I know that they're reviewed by a team of people, and they're not that simple to get.
Thank you. I believe the next question, part of it has been answered, but we will go to it. How is Rutgers measuring productivity? If measures show more productivity while working from home, will employees be able to telecommute permanently?
So there are some areas that because of the nature of work they do, they were able to quickly assess productivity and the productivity increase. So for example, we have billing areas in healthcare where they are able to very easily assess productivity pre and post pandemic by the number of bills and the revenues collected. And that's a hard and fast figure. Those are dollars. As you know, we don't have that in other areas. And as I've indicated earlier, that will be one of the topics addressed through the Future of Work Task Force, because we want to assure equity as well. We want to assure that individuals that are working remotely are held to comparable standards within the needs of the department and the mission and the vision and the services provided to the university. So that's something we will be working on, but it's a good question because we do get a lot of, I'm more productive now than I ever have been. And as Tony indicated, how are we measuring that? When are you working? Is that really meeting the needs of our students, our patients, and the publics that we serve?
Thank you. Next, can we seek religious exemption for testing?
Can. There is a waiver form that is attached to the email that if you were identified as a person that needs to be tested because you have not uploaded your card, you can access. I want to stress that this testing is the saliva test, which is non-invasive, and the material is destroyed once the test is run. So it would go through a committee review as well to determine whether it is a valid exemption, and you would be notified.
Thank you. Will employees who are not vaccinated and do not test weekly be disciplined? How is the university making sure that employees who are not vaccinated are actually testing?
So I could take that one, Vivian. So the answer is yes, they will be disciplined. This is now a mandate by the state of New Jersey. So it's not a university policy, it is a mandate by the state of New Jersey. So yes, we would pursue if you are required to test, and it's clear that it's either vaccination or test. And if you are not, then we would pursue, as with so many other things, progressive discipline up to and including termination. The university is making sure at the central level, we are not putting testing on supervisors. So if a supervisor has a half a dozen employees that work for them, there's no, first of all, the supervisor should not even know that you are testing or that you're vaccinated. That's number one. And we have not put that information out there anywhere. Number two, it is being handled at the central level because of privacy issues, to make sure that your privacy is protected and we are in compliance with any applicable laws. So we will take care of that again at the central level in assuring that you are doing what needs to be done.
Thank you. If unvaccinated employees are forced to test, can testing be done during work hours, or are we forced to test on our own time?
You are absolutely allowed to test on our time. But I want to stress, our time also includes the time that you're home working for us. The testing program is once a week, whether you're in or you're out. So let me be clear about that. If you're working 1 week home, as we saw a question a little while ago, 1 week from home, 1 week in the office, 1 week from home, 1 week in the office, the weeks you're working from home, you need to come in and get tested as well. Vivian, did you want to add to that? Because I think that.
Yeah, that's exactly right. The tests occur on campus. So you have to be on campus in order to test, and it is once a week.
Thank you. The CDC has updated their recommendations. If you came into close contact with someone with COVID-19, get tested 3 to 5 days after the date of your exposure and wear a mask in public indoor settings for 14 days after exposure or until a negative test result.
Yeah, that's no different than what we've talked about. So the question earlier was about exposure. What this does not say here is what the definition of close contact. So there is a very clear definition that the CDC has put out with respect to what is close contact. Let's see if I have it. So the CDC defines exposure or close contacts as 15 minutes within 6 feet of a person who has COVID-19 without any type of appropriate protection. And then that could be built into a 24-hour period. So casual contact does not require you, a fully vaccinated person, to have to quarantine or be tested. So that is not in conflict with what we said earlier.
Okay, next question. Why can't vaccinated individuals get tested through the university testing program? If we have symptoms as a vaccinated individual, we should still want to know if we are positive. The university testing system is the easiest way for us to get tested quickly.
Do you want me to take that one?
Yes.
Okay, so there are a couple of reasons that surround this. Number one, if vaccinated individuals are, this is a CDC recommendation as well, should not be tested. Only symptomatic individuals should be tested. So if you have symptoms as a vaccinated individual, if you're using your MyPass, you shouldn't even be on campus. That's number one. Tests are commercially available everywhere today. Every pharmacy, every clinic, every healthcare provider has tests, and for the most part, they are quicker than the ones that we do. So the antigen tests that you can get a quick response to are readily available today. The third piece of this is that the university does not have an infrastructure to be able to test vaccinated and unvaccinated individuals as well. It would require literally 100,000 tests a week if we were just doing it once a week. So we don't have the ability to be able to do that. We send these out to a lab as well. Typically takes as long as 72 hours to get any type of result back. And we can't forget that testing is retrospective. It's not prospective. It won't tell you if you're going to get sick. It just tells you if you're sick. By that time, it's too late for us. So again, if you're having symptoms, if you're symptomatic, you should not be relying on the university. You should get yourselves, and by the way, this is tested or vaccinated or unvaccinated, you should get yourselves to a healthcare provider immediately to get ahead of any type of illness that may be forthcoming.
Thank you. Next question, is there a resource departments may use to help them determine if the protocols they are putting in place are in line with the Return to Campus initiative? Many departments are apprehensive to make final decisions within their own departments unless UHR OneSource confirms what they should do.
So one of the resources is you can call facilities. The FAST team, FAST, will look at social distancing issues and talk to department heads about what would work best in their unit. So yeah, that resource is available. Vivian, I'm not sure about others.
Yeah, so and where supervisors are not certain, then the appropriate response would be to follow the hierarchy up through the senior person in the area. If you call OneSource or HR, We cannot determine what your business needs are. We cannot determine what your staffing needs are. We cannot determine what the priorities established within the area are from your senior VP or executive VP. So you really have to follow the hierarchy. Again, one source in HR will not make determinations related to what your departmental needs are in terms of who comes back to campus and what should be prioritized. If there are safety concerns, there's an email on the COVID-19 website. If you don't feel comfortable going to your supervisor, there you have the ability to submit those so that they could be addressed.
Okay, thank you, Vivian. We just have time for one or two more, I think. As we approach the fall, more and more people will probably come down with the common cold. How should we act when we feel symptoms of the common cold? If I'm vaccinated, will RU cover testing costs due to confirm a negative COVID case?
So you should be using your MyPass, and common colds are covered by sick time. And in the past, I know many people decided it was easier to come in than use a sick day. We are imploring you to stay home. No, RU will not cover the cost of a test. Vivian, you want to fill in there?
No, that's it. So we have always, every year, we send out a communication. If you've got a fever, if you're not feeling well, stay home. Of course, that communication was all about the flu, and it's even more significant now that we will have the common cold, the flu, and COVID-19 converging in the fall as we move forward to colder weather and being indoors. That is what your sick days are for. If you're sick, stay home. Again, the testing happens on campus. Tony has already said, if you're not feeling well, stay away. Take care of yourself. You might want to ask your supervisor if you can work remotely, if that is available to you, and make an exception or change a day out. That would be fine. But yeah, don't come to campus, and keep everybody safe.
Okay, I think we have to start wrapping up at this point because I know Vivian and Tony want to add some final thoughts for this presentation. So Vivian, would you like to go first with some final thoughts?
Sure. Again, we'd like to thank you all for your contributions and for your patience as we work through what this working environment will look like moving forward. Tony indicated that I'd provide some resources for you. In case you missed it, we did send out information related to the My Wellness app, which is an app that was developed in collaboration with University Human Resources, RBHS, University Communications, and OIT. And the app is geared towards supporting your physical and mental well-being. So you can access that app through the My Rutgers portal. And then in addition to that, there are other resources that have been made available through University Human Resources website related to returning to Rutgers. There are learning resources available. I encourage you all to go to our website and look through those resources.
Thank you, Vivian and Tony. Would you like to add some final thoughts?
I would. So I want not to leave anyone with any illusions. We will have cases on campus. We will have cases in your departments. There's no doubt about that. We look at the numbers. We know that's happening. We know that's to be expected. What I'm asking you is not to panic when you hear of a case, because a lot of times there are too many rumors going around. Remember, vaccine protects you. The vast majority of you are vaccinated. Masks protect you. That's why we mandate them indoors. Social distancing protects you. That's why we mandate it indoors. So you do have protections around you. But let me talk a little bit about notifications. Occupational health will take the lead on notifying individuals when that is necessary. If there's an exposure that they believe you were a close contact to, They will take the lead in making sure that you know about that. We have contact tracers on staff. We also notify the local Department of Health, irrespective of where you are, Camden, Newark, or New Brunswick. So we know how to do this. We've been doing this for a year and a half. It's not up to supervisors to notify people to send them home. Please do not do that. Let occupational health do their work. If you are tested at work and you test positive, occupational health will reach out to you, will take the lead, will reach out to the individuals that may have been close contacts. If you test at home and you test positive, I ask that you please let occupational health know, and then they take the same steps moving forward, okay? We don't need, and they will talk to supervisors to provide guidance as well. We don't need to create panic. We do not need to create panic. And that is not our intention. We have a lot of good protections in place. We have good protocols in place. We have to let the system work. We are a big place. Are there failures? There's always going to be failures, but we're not going to sacrifice anyone's health or safety as we move forward. I want to end by saying thank you. Thank you for attending, and thank you for all of the work that you do on a regular basis. Thank you.
Okay, I just want to remind everybody that this Zoom meeting will be posted on the IPNO website, ipo.rutgers.edu. In addition, we will address any unanswered questions that we received here today. And if you would like to submit questions after the fact, you may email me at cranec@ipo.rutgers.edu. I thank you for joining us, and we thank Tony and Vivian for giving us so much time this morning. Take care.